Hello, my name is Bria Miles, and my topic is universal health care. And my major claim is that universal health care will be beneficial to all Californians. Universal health care is a system that provides organized health coverage to all citizens of a governed region and is publicly funded through taxation. My three supporting claims are that universal health care would reduce overall medical costs for all Californians, universal health care would provide an overall stable system for all citizens, and illegal immigrants will be forced to pay for their health care. So back to my first claim, that universal health care would reduce overall medical costs for all Californians. Citizens would spend less money on other people's trips to the ER. Emergency departments are mandated by law to medically evaluate and provide stabilizing treatment of emergency conditions for everyone who comes through their doors. And that being said, it is projected that $91.2 million is to go to the health and human service programs under the 2012-2013 California state spending budget. So with universal health care, those funds could go elsewhere, and extra funds would not have to go to overpriced insurance companies. The universal health care program would pay for itself through health care taxes. SB 810 is an example of a bill that was tried in California in 2009 and actually passed in 2010, but was pulled on the last day of the legislative session. However, it gives a brief example of how this could possibly be funded, and under the system, all healthcare taxes would go into one trust fund, and all expenses are paid by that one fund. It would be a true nonprofit insurance system which would provide comprehensive benefits for all California residents and pay for all covered charges to providers, hospitals, and pharmacies. With universal health care, it would provide Medicare and healthy families for everybody and not just those that qualify. Medicare is the nation's largest social welfare program and is an open-ended entitlement program that provides coverage for a defined package of services. And under these terms, it pays for as many covered medical services as the eligible population uses. Typically, the qualifications for Medicare are being 65 or older, and you or your spouse has worked at least 10 years under covered medical employment. Healthy Families is low-cost insurance for children and teens, providing health, dental, and vision coverage to all children who don't have insurance, and is only available to citizens 18 and under. And according to the group One Care, currently 1/2 of all money now spent on healthcare comes from federal and state spending for various public programs such as Healthy Families and Medicare, and this money would all go into one insurance fund, and employees and employers would contribute to that fund to help produce universal health care. My second supporting claim is that universal health care would provide stability for all citizens. Many people risk their lives each year ultimately because they cannot afford to go to the doctor. According to the U.S. Census Bureau, 27.5% of Californians don't have health insurance. The advocacy group Families USA developed a study that calculated that 3,164 Californians died as a direct result of not having health insurance between 2005 and 2010. Other regions that have obtained universal health care have shown that it would be beneficial to citizens in California. The UK has the National Health Service, which provides care to all citizens without the need for direct payment. Australia has Commonwealth, in which its grants pay for 50% of the funds needed, and the states and territories come up with the remainder. Commonwealth also supports medicine with the pharmaceutical benefits scheme, and that pays for 83% of the co-payment. And my last supporting claim is that if we develop this system, immigrants will be forced to pay for their health care. The issue with immigrants is very prevalent in California. At least 1/3 of immigrants lack health care, and currently they receive free doctor visits from going to the emergency room. Because of this, as much as 2/3 of the total operating costs for hospitals go to uncompensated care for illegal aliens. As a result of this, hundreds of emergency departments have closed. For example, 10 hospitals in Los Angeles have closed in the past 5 years because of uncompensated care. So with universal health care, another source to funding it would be to apply the cost to sales tax or gas tax, and that would ensure that everyone would share in the cost. So with all of that, I would like to conclude that universal health care will be beneficial to all Californians because it will reduce overall medical costs for citizens, provide an overall stable system for Californians, and force illegal immigrants to pay for their health care, thus providing insurance for all California residents.
Okay, the proposition is very clearly identified at the beginning. I think that you could use a little bit more background information on the controversy so that we know why this is something that has to be advocated, especially since we have the Affordable Care Act that's recently been passed and put into place. Why is universal health care necessary in light of the existence of this particular program? So I don't get any explanation on that, and if this is substantially different than what is sometimes referred to as Obamacare, you need to clarify that a little bit more. I thought that you had an excellent layout of what the secondary points were going to be, and you did a very nice job signposting those as you got to each of them. I think your transitions between those points could be a little bit smoother. Sometimes it just shows up like the sign right out of the blue instead of being eased into the next point, and so it could be a little bit smoother, but I thought your delivery was very fluent. Your eye contact could be a little bit more solid with the audience. Those are general delivery issues. On content issues, I think that you have a general explanation of what the process is. I think you need some more particular data on the effectiveness of these programs. For instance, you make comparisons to Britain and Australia and their programs. We need some explanation about how successful they are in comparison to the U.S. You have this one statistic that says over like a 6 or 7 year period, 3,100 people in California died because of a lack of health care insurance, and that needs to be explained a little bit more. But the other question is, how is this going to be better with this new proposal that you're talking about? And that's one of those things where those comparisons that you're making ought to be providing us some data about lower mortality rates or higher or quicker responses to illnesses, or how people survive illnesses longer because they get earlier treatment or something along those lines. And I think that that was a little bit lacking. Sometimes we got some statistics and some factual data without getting sources. And there was one mention of 10 hospitals in the Los Angeles area that had closed because of this problem with uncompensated patients. And I don't know where that information came from. I'm not doubting it, but if you're going to present information, you need to make sure that you give us a source citation. All right, thank you very much.